This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
The city government of Marikina implemented an ordinance banning all residents and resettlement sites from owning pets, particularly dogs. This ordinance aims to have a rabies-free community.
Mahigpit na pinagbabawal ang pag-aalaga ng klaseng hayop sa loob at labas ng bahay para po protektahan ang kalusugan ng mga tao at saka animal welfare. Tanong na po kami sa human rights na sinasabi doon na hindi naman karapatan ng pag-aalaga ng hayop. Ito po ay isang privilege.
But the Philippine Animal Welfare Society, or PAWS, is against the ordinance.
To damn an entire community of the privilege or the right, actually it's a human right, to take care of a pet, whether it's a dog or a cat, to ban an entire community of doing that is not just anti-poor. It's also a violation of their human rights, like I said. If the owner of the pet is responsible enough to keep their pets indoors, whether it's a resettlement or a condo or an exclusive subdivision, they have to be given the right, whether they're rich or poor.
Rabies is a disease that is transmitted to humans from animals that is caused by a virus. It is spread through saliva by bites or scratches from the infected animal.
Rabies po, isa pong sakit yan na nakukuha po ng tao pagkatapos po silang makagat ng isang rabid na animal. So, maaaring hindi lamang ito limitado sa aso na may rabies, kundi maaaring din po tumako sa mga pusa.
Dogs are the source of the high number of human rabies deaths.
Pag ang aso kasi ay gumagala, yung sinasabi yung gumagala, mas tumataas po kasi yung risk na magkaroon siya ng contact sa ibang hayop din na magkakaroon ng rabies.
What are the signs and symptoms of rabies? What are the risks of this disease? What are the pet owner's responsibilities towards its prevention? What does one do when he or she has had an encounter with a rabid animal? More about rabies tonight on MedTalk.
In almost every Filipino household, there is a pet. This is because we are animal lovers. So tonight, let's get to know more about rabies that we can get from our pet dogs and even our pet cats. Joining us tonight is Dr. Mary Elizabeth Miranda, epidemiologist and infectious disease specialist. She's also the Asian coordinator of the Global Alliance for Rabies Control. Also with us is Dr. Nicolas Carpio, veterinarian and co-founder of Vets in Practice. You can participate in the discussion by following us on Twitter. You can also post on our Facebook page or send us an email. Good evening, doctors. Welcome to the show.
Evening.
As mentioned in the VTR, almost every Filipino household has a pet, be it a cat or a dog. And we love them, we care for them, we want them happy and healthy. But when they bite, or maybe even scratch us, that's an entirely different story. And the first thing that comes to mind is rabies. So what exactly is rabies and what causes rabies? Doc Nick?
Well, basically rabies is a virus. Now, it's actually naturally it comes from mammals, okay, and it's actually transmitted through saliva and not from blood. So, yeah, and if an animal bites you, like for example dogs bites you with rabies, when he's infected with rabies, then basically you will get the rabies as well if you don't treat it immediately.
So what can cause these rabies, and what is in the saliva of this dog or maybe a cat even that can cause rabies, doctor?
Rabies kasi is an infectious disease, and it is a disease that is transmissible from animals to humans. And usually, in the Philippines and in most of Asia, dog rabies is the most important source of human infection. So, yung transmission is from the saliva of an infected animal that is injected through a bite to a human patient or another animal. And the virus is transmitted from dog to dog or dog to cat, and some of our livestock, few livestock cases have been traceable to an infected rabid dog bite. So it's the virus in the saliva that is injected into bite wound.
Where does the dog get this infection or the infected saliva? Where does he get it from?
Well, Doc, I think it's for the epidemics.
The dogs get rabies from other infected dogs, and the perpetuation of the infection among the dog population is usually continuous, and it goes through a population of animals that are not protected or unvaccinated against rabies. So if you have a population of animals that are susceptible to the disease, the transmission is continuous from dog to dog, and then when infected dogs die, before they die, they're transmitting it to other dogs. So it's really, like in the Philippines, we call the disease endemic because it is present in almost all islands. You know, there are very few islands that have been declared free of rabies. And the way to deal with it really is prevention through vaccination.
Okay. So it doesn't necessarily mean that if your dog has has a certain type of breed, that he will be free of rabies, or if there are dogs on the street, automatic may rabies na yun.
No. Well, there's always a misconception that all dogs are born with rabies, or even cats. It's a misconception. Basically, dogs or cats get rabies when they are bitten or be infected by another rabid animal. So if you get a dog from like, for example, you buy it from a pet shop or get it from a certified breeder, if a puppy bites you, basically, and it's still like there's no rabies vaccine yet, there hasn't been, basically it's a very small probable chance that you'll get rabies in that one.
You talk about a puppy that bites, that accidentally or intentionally bites an individual. The chances of that puppy having rabies is still very low.
Very low. Since it's domesticated, and it's not like a wild animal that you got it from the wild and then you just take care of the puppy. No, it's not like that. It's basically been bred through numerous, of course, mothers that has been injected with rabies vaccines.
So we talk about the vaccine before maybe we go to signs and symptoms. Let's talk about the vaccine. Exactly. How is the vaccine administered? At what age of the pet or the cat or the dog is the vaccine administered, and what type of vaccine is this?
For rabies, there are already modern and highly purified effective vaccines for animals and for people for preventive vaccination. In animals, the rabies vaccine are usually given at 3 months old. And because in the Philippines, rabies is still widespread, the recommendation is usually annual revaccination because it does not give lifelong immunity. For people, usually there are two types. When a person is bitten by a suspect rabid animal, we call the vaccination post-exposure vaccination when you are bitten by a suspect animal. We can also give the human vaccine for preventive vaccination. We give it to veterinarians, for example, or community workers who, or even in travel medicine, it is already recommended because there are many travelers who go to infected countries, countries with dog rabies particularly. The recommendation now is for people to receive preventive rabies vaccination in people.
So you don't have to wait, not that you're waiting to be bitten or that you're waiting for an animal to bite you by accident, but it's also recommended already to everyone or just to pet owners, would you say?
Well, sorry, Doc, but yeah, for us, for example, we are always handling dogs No, that's our job. So basically, for those who people who handles a lot of animals like that, like in the zoos or anything like that, then I would recommend that. But for owners, I don't think so. Yeah, it's up to actually to them to vaccinate their dogs to their veterinarians, so that they know that they'll be actually safe.
So, keeping in mind that these pets have already been vaccinated, and then there's an accident that happens that they're bitten. So what happens to the individual knowing that this pet has been vaccinated already?
The risk of getting rabies from a vaccinated dog is very low, almost nil. That is why we emphasize in public health practice to have pets vaccinated and leashed at all times or at most times, so that the risk of transmission from dog to dog is minimized.
And in my practice, no, it's funny because most of my clients, they don't call the physician when they're bitten by their dog.
They're campante already.
Yes, they call.
They call you.
They call us.
The vet,
no?
yes.
The doc, I was bitten by my dog. Will I have rabies and everything like that? So, of course, I told them no. Of course not. No, because it's vaccinated and it's domesticated. And actually, the vaccines that we use here is actually good for 3 years. But as what Doctora said, no, it's the law that we have to vaccinate yearly. No, but the vaccines that we use is actually good for 3 years, like what in the States does. No, it's every 3 years, not every year. No, but then again, going back there, they're scared kasi. They're scared. I mean, who won't it be, no? Because of the rabies. But there's a lot of misconception. That's why we have to clear things out to the community, actually.
We'll go back to that in a while, doctors. Okay. We'll answer first a question from Facebook. If you have an open wound and, well, this individual has an open wound and the dog licked it, would I be infected with rabies?
Again, no, not all dogs have rabies, and especially if they are vaccinated, the likelihood that they are infected is very low. Licking of an open wound is what we call a possible exposure to rabies. But again, if the dog is vaccinated, it's unlikely. But if it is a lick from a stray dog, an unknown dog, a dog that is unvaccinated, it is actually considered a Category 3 bite, no, the highest of yung possible exposures, because it is a possible direct injection or inoculation of the virus into an open wound.
What about if the puppy licks your open wound and he hasn't been vaccinated for that year yet? But as you said, 3 years naman ang validity, no?
Well, basically, what you do first is basically wash your hands with soap and water. No, sometimes I suggest detergent because it's stronger. Any antibacterial soap will do. But usually, I tell to my clients, you wash it 5 minutes. At least 5 minutes.
Under running water.
Under running water.
Do you
soap,
rub? Just soap?
Rigorous.
Rigorous
you can rub it. You can rub it. No, unlike like for example snake bites. You sip the blood and then you spit it out. No, but not for virus. No, as long as the saliva is there, it's there already. You just have to wash it. You just have to wash it.
What does that do? Does it take out the saliva of the dog?
Yes, mostly yes.
Washing the wound after an injury actually mechanically removes the virus from the surface of the bite. But still, you are not sure whether some of the viral particles have already been injected deep and they are not removed by washing. Then that is why post-exposure vaccination is recommended.
So after washing and you feel that it's still not enough, that's the time to...
Actually, the SOP is to wash the wound as an important first aid measure and consult a doctor so that you can be assessed kung anong category of exposure and what type of vaccination regimen you have to receive.
We'll go to... go ahead.
Okay. No, unlike before, Doc, correct me if I'm wrong. Before, kasi the shots for post-exposure is 26 shots, around like that.
No? The individual.
Individual. So just imagine how painful it is. No? Pero right now, there are a lot of modern already vaccines for post-exposure. It's takes 4 to 6 shots only.
So we'll go back to
Yeah.
that and the levels of the bite or exposure in a while, but we'll answer this question first from our Twitter page. Doctors, I was bitten by our pet dog when I was still a kid. Am I still at risk of rabies now that I'm already a grown-up?
When we are asked this kind of question, mga long ago historical possible exposures, our first question is, did your dog become sick or die during a period of 2 weeks? You know, if that bite were from their own pet and the pet remained healthy, the risk is nil. So it's unlikely that they're incubating rabies. But if that bite were from an unknown stray animal or an animal that became ill and died after the bite, then the risk is high. The problem with the rabies, the incubation period is very variable. It can be as short as 4 days, as I have seen in a small child bitten in the face by a rabid animal, or as long as some anecdotes from patients as long as 20 years.
10 years, 20 years.
But the average incubation period from the time of bite to the development of signs and symptoms is 3 weeks to 3 months. So after a true rabid bite, within 3 months, the signs and symptoms will already appear in an infected person.
So the humans and the dog, good sana if we know the history of this animal. If it's maybe your own pet, so or a friend's pet, but sometimes we don't know the history of an animal on the street. And we don't know what will happen to that animal. But we'll talk about that when we come back. MedTalk, we'll be right back.
Did you know that the Philippines ranks 6th worldwide among countries most affected by rabies? Reported cases of death every year is 200 to 300. Majority of rabies victims are children under 15 years of age.
We're back here on MedTalk. Doctors, we have a question from our Facebook page. When someone is infected with rabies, is it possible that I also get infected through skin-to-skin contact?
Ang transmission of rabies is usually really entry of the virus into a wound or into your mucous membranes like the mouth or the eyes, or in small children, the risk of genital exposure is also considered a possible exposure. So skin-to-skin contact is considered a non-exposure if it's intact skin. But if the skin has a break or a wound, then that is considered an exposure.
Okay, all right. And doctor, if wala namang sugat and then you are accidentally bitten or licked by a dog, the chances of you having symptoms of one that is bitten by a rabid dog is nil?
Nil.
Yeah.
Okay. How about, so we're still talking about, how we love our pets and how we should be responsible enough to have them vaccinated, as well as the pet owner.
Yes.
It should also be a responsincility that we should also get vaccinated. But there are other animals that, are roaming in the street, who don't have vaccine, who might get into contact with our animals, our pets that have vaccine. So when a dog that has vaccine or it has been vaccinated with rabies is bitten by one that has no vaccine, what happens to the dog that has been vaccinated?
We had cases like that when a client of ours brings their dog, and they said they had a dog fight with another stray dog. We just basically, of course, we check the records and it's complete with vaccines, or he has a rabies vaccine, so he's already safe. It's more of what we're looking at now is more the trauma of the dog, the shock, or the wound, the infected wound that we're more concerned of. But after that, if everything goes well, like with the stitch up or anything like that, we again give rabies shot and then a booster after 1 month, just to make sure that the dog is complete with rabies.
And now we'll go to our signs and symptoms of let's go first to the dog that has been bitten by another rabid animal. What are the signs and symptoms that this dog will manifest?
So the signs of rabies in animals and here in dogs, you would watch out for aggressiveness, yung unusual aggressiveness, drooling of the saliva, aimless running. Really, it's a mad dog syndrome that you have to watch out for when observing a suspect rabid animal. In people, once the clinical signs of rabies manifests in a person bitten by a rabid animal, the signs can be very similar. A patient would experience a severe itching at the site of bite, a prodrome phase where the patient experiences headache, and then he goes to that terminal stage of madness, similar to a mad dog, shouting, drooling of the saliva, aggressiveness, and this happens in 80% of most human cases. The 20% would manifest the paralytic or the dumb form of rabies, or they would, some patients would go into coma and die. But more commonly, you'll see the aerophobia, the hydrophobia, or the fear of water in the terminal stage of rabies in people.
What should an individual do when one manifests these signs and symptoms?
Rabies is 100% fatal. So once these clinical signs appear, it is the point of no return. So it's already terminal stage. And for all the patients that I've seen through the years of working in public health, a patient who has started showing signs like this will die within 48 hours. So really the key to rabies is prevention.
Prevention, yes.
So again, we can't emphasize enough the responsibility of the pet owner to have their dogs vaccinated.
Yes.
What other measures should one take in order to hopefully prevent?
Actually, can I add on to Dr. Basically, for people who are curious, for example, for a wild animal, for a bat, for example, if you see a bat that just fell down from the tree and then it's like it's sick, don't approach it and don't get it. It might be sick because of rabies. We wouldn't know. So why take the risk? For example, for wild animals, for example, if wild animals are wild basically, and they're not social animals in terms of humans, no. So if this animal approaches you, like looks tame or anything like that, you have to be, it's a questionable thing already, So those are more preventive, is just don't approach stray dogs or stray cats.
It's tempting kasi to see when you see an animal, you're
right,
like,
of course.
kawawa naman.
Yes.
I want to, take you to my home, take care of you.
The thing is with not NGO groups like for example PAWS and CARA, they're all already have this rabies vaccine in them, so they can actually help the people. So in case they see a kitten or a stray dog in the street that needs to be tended to or help, then they can call these groups, which they're experts to get those animals.
Don't attempt to do it yourself.
Yes, don't attempt.
Never do that.
Yeah, don't do it at home.
Don't do it at home. Because when animals attack, that's what's going to happen.
That's it.
We'll go back to our Facebook question. Can garlic be topped over the bite as a first aid, especially with its medicinal values? Garlic.
Still, you would need to wash the wound
Yes.
with soap and water. These are traditional
Medicines.
ways that people know how to treat a wound, no? Any kind of wound. But for rabies, it's still very important that the wound is washed with soap and water. This is the most important, most elegant form of prevention that is accessible to most people.
That is first aid, the only,
First aid.
the first.
Yeah. First thing that comes to your mind is wash.
Wound washing.
Basically wash. At least 5 minutes.
Even just a little scratch.
Even
If
little
basta there's
scratch,
blood,
Yes.
basta there's blood, you
Yes.
have to wash it
Just wash it.
right away.
Yeah. They say how come they get rabies from a cat scratch?
Yes.
Basically because they lick their paws. So the saliva is there in their claws, and then if they scratch you, you can get rabies as well. So better wash it.
Right. Do you cover the wound or do you expose the wound?
No, usually, cover the wound to prevent the secondary infections.
Yes.
Are there particular body parts that when bitten by a dog that you suture or that you leave open?
Depends on the severity of the bite.
Yeah.
But usually, for rabies exposure, a head or neck injury is usually considered a high-risk bite
risk.
because rabies is a nerve, neurotropic virus, and it infects the nervous system. So the closer the bite is to the central nervous system, the higher the risk.
Yes.
Okay. So we also have this, I remember the RA 9482 Rabies Act of 2007.
Yes.
Maybe we can talk about that a little bit,
Yes.
Dr.
The National Anti-Rabies Law of 2007 is about prevention and control and eventual elimination of rabies in the Philippines by 2020. So in that law, there is mandatory registration of dogs and mandatory vaccination. In many local governments where resources are not enough to run, and people in fact cannot even afford to have their dogs seen by a vet, let alone be vaccinated against rabies, this program promotes and supports the prevention and control of rabies in animals as a source of infection in people. And the target is to eradicate rabies nationwide in all islands of the Philippines by 2020.
So how is that coming along in 2013, Doctor?
So many local governments have already realized the importance of investing in a public health program like rabies by targeting the source of infection and investing on mass dog vaccination. A lot of local government units, provincial and municipal level, are already embarking on more aggressive rabies prevention and control.
Which is good.
Yeah, I think if the government, the LGUs work together with the community, I guess we can eradicate rabies, no? Like what happened to foot and mouth disease, no? We basically eradicated it already. So, it's possible. It's possible. Yeah.
Because as your shirt reads, walang nabubuhay sa rabies. So, talagang kailangan natin na maging mas conscious. We have to be more aware of the responsibilities that the pet owner has.
Right.
And, to know also the history of the dog.
Right.
When one is bitten, hopefully hindi naman na makagat and rabid the animal. But yeah, just prevention is always key.
Right.
So any last tips to our pet owners and to those who are animal lovers, and even to those who, don't have pets?
Okay. Well, to the pet owners, I would recommend, of course, if they're gonna walk their dogs to the villages or to the parks, make sure that they have the leash with them. Okay. And make sure also that to visit your veterinary your vet and update your vaccines. And that's about it.
Thank you very much, Doc. I will update my dog's vaccine soon. Dr. Miranda, yes, please.
The general public and many policymakers do not, in fact, realize the burden, the economic and the health burden of rabies because it is a disease of animals, but the impact is in people. So we cannot overemphasize the value of prevention and targeting the disease at source, from animals, from dogs. Here in the Philippines, is primarily from dogs. And when there is a public program in your own community where there's free mass dog vaccination, you must go and take advantage of that, because it's not only for your own pet, but for the rest of your community.
Right.
Thank you very much, doctors.
welcome.
Thank
You're
you.
welcome.
Again, we'd like to thank our doctors for sharing their knowledge, their expertise about rabies. Once again, thank you to Dr. Elizabeth Miranda and Dr. Nicolas Carpio. See you again next Tuesday on MedTalk as we talk about addiction. 10 p.m. on your scheduled on-air consultation on the Solar News channel. This is Angel Jacob. Good night.